Provincial COVID-19 update.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Thursday, April the 1st. Honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. Honored to be here on their lands today. Tomorrow, Friday, Good Friday, there won't be any briefing or update. We will be updating by written brief on Saturday, updates on case counts and hospitalizations and other relevant information about COVID-19 in British Columbia on Saturday, April the 3rd, and then we'll be providing a in-person briefing next Tuesday after that. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you, and thank you very much, and good afternoon. As I did last week, today we'll be taking a slightly different approach to our usual briefing format and addressing some of the questions that I've received over the past few weeks. We'll just start with a high-level daily case information and then go through some of these questions. So in the last 24 hours, we've had 832 new cases diagnosed of COVID-19 here in British Columbia. And again, yesterday we went over that precipice of 100,000 cases, and we now have 100,880 people in British Columbia who have been diagnosed with COVID-19. Today, 310 were in the Vancouver Coastal Health Region, 388 people were in the Fraser Health Region, 53 people were in Vancouver Island Health, 42 people in Interior Health, and 39 in the Northern Health Region. We currently have 296 people in hospital with COVID-19, 79 of whom are in critical care or ICU. We've had an additional 5 deaths to report today, bringing the total number of people who've died from COVID-19 to 1,463 here in British Columbia. And our condolences go to the families and care providers and the communities who've lost their members. To date, we've had over 787,649 doses of all 3 COVID-19 vaccines that we've had available administered in BC, and 87,394 second doses. More of the details on things like variants of concern and the outbreak status will be in the statement when it's later this afternoon. I know many people continue to have lots of questions about COVID-19, about our pandemic, and about the vaccine, and I am always appreciative for the questions that people send in. I'm going to start today with talking a little bit about some of the vaccine questions. We now have 3 safe and effective COVID-19 vaccines here in BC and 4 that have been approved for use in Canada so far. And many people have asked me about the differences between these vaccines and about other vaccines that we have. So as many people know, the first vaccines that were approved were produced by Pfizer, BioNTech, and Moderna. And they are the main ones, the most that we've had here in British Columbia, and they form the basis of our age-based risk program here in BC. And these are called messenger RNA vaccines. Since these have been approved, the latest 2 vaccines to be approved are what we call viral vector vaccines. They're the AstraZeneca, Oxford, or Serum Institute of India, same vaccine manufactured in 2 different places, the Covishield vaccine. And the other one is the Janssen, which is the pharmaceutical arm of the Johnson & Johnson company. Both of these are similar vaccines. The Janssen one, however, is a single-dose vaccine. So all 3 of the others are 2 doses, which means you get 1 dose to prime your immune system and then a booster dose at some time later to increase and lengthen the time that your immune system responds to the virus. One of the things that we are learning is in the clinical trials that were designed was a wonderful collaboration around the world to try and get these vaccines, and it is amazing that we have 4 effective and safe vaccines that were developed within a year of this virus even being identified. What we do know is that the clinical trials were done with as short a period of time in between doses as possible so that we could get as much information and get the vaccines out there as quickly as possible. So the first dose primes your immune system. The second dose leads to longer lasting protection. What we have learned since from the clinical trials is that all of these vaccines are very effective with the second dose and the first dose, upwards of 76 to 79% and over 80% for the messenger RNA vaccines. In the real world, however, we are also finding out that these are very effective vaccines at preventing people from having serious illness, from hospitalization, from death, and we're finding more and more information that they do prevent even milder symptoms in people as well. And importantly for us, we've learned from the real world experience in the UK, in Ireland, in places like Israel, and here in Canada, both in Quebec and BC, where we have strong programs, research to follow this, that after a single dose, you have very good protection, upwards of 80%, and that lasts for many months. So these are important things that we have learned. I've been asked a lot about how the body mounts its protection against the virus, and if I'm vaccinated, why do I still have to wear a mask? It takes time for our body's immune system to respond to the vaccines, no matter which vaccine it is. And it develops 2 types of immunity. The first is one that we can measure in the blood, and this is called our antibodies. And we've seen a lot about antibodies recently because they're one of the markers that helps us understand if we have those protective mechanisms against the virus. These antibodies bind to the spike protein on the outside of the virus, and all of the vaccines that we have so far are designed to develop, for your body's immune system to develop antibodies to the spike protein. What we don't know is what level of antibodies we need in our blood to protect us from infection or from a disease with this virus. That's what we call a correlate of protection. So if antibody levels don't get as high in some people, and we saw a study including some from here in BC, where antibodies in people who are older or people who have certain blood cancers or certain types of immune compromising conditions, those levels may not rise as high as they do in younger, healthier people. But what we don't know if that has any effect on how well the virus or the vaccine protects you from the virus in the first place. What we have seen from the vaccine effectiveness studies that we have is that regardless of antibody levels, there's a very high protection in seniors, in long-term care, that lasts for many months, in healthcare workers, and we're continuing to monitor this on an ongoing basis. It could be because we have the other part of our immune system stimulated as well, and that's what we call the cell-mediated immunity. So triggering of the B cells and the memory cells in our body that activate if we're exposed to the virus. These take longer to develop, and they can't be as easily measured with a blood test. So the bottom line that we are learning and why we are continuing to focus our program the way we are is that the protection is very good, not perfect, but very good after a single dose. But it takes time for our body's response, so that protection isn't high enough in everybody for about 21 days after vaccination. And for some people, that protection may not get as high even after 2 doses. So people can still be infected with COVID, particularly in the first couple weeks. And that's why right now it is still incredibly important, even after you've been immunized, even if your community has been immunized, that you take the precautions that we all need to continue with, wearing masks, keeping our distance, not getting together in crowds. Because even though we are partially protected, it takes that period of time before we are all protected. And the good news is, though, even after that single dose, within that shorter period of time, as our body's developing the immune response, we tend to have less severe disease. And we've seen that even though people can get infected, they don't end up in hospital, and thankfully we haven't had deaths. But these are the things that we need to pay attention to for the next few months as more and more people are immunized. I've often been asked if I've had I get many questions about if I've had a reaction to another vaccine, particularly the influenza vaccine, can I get a COVID vaccine? And the answer is yes. These are very different vaccines. They're ones that are new platforms. They're things that we've not used before, and they tend to have very few ingredients in them. What we do know is that the messenger RNA vaccines do stimulate your body's immune response and can stimulate allergic reactions, and the product or the compound that stimulates the allergic reactions more frequently is called polyethylene glycol, or PEG. So if you know you have an allergy to PEG, and some people do, then you should be looking for the AstraZeneca or the Johnson & Johnson vaccines. Otherwise, most people don't have any reaction to don't have allergic reactions to the messenger RNA vaccines, and we know that the safety profile is really good. I've also been asked if I've had Guillain-Barré, which is sometimes comes after, has been associated with some other, both viral infections, but also some immunizations. Can you have a COVID vaccine? And so the answer again is yes. The Guillain-Barré is a type of immune response, autoimmune response to your nervous system that is most often triggered by the infection itself and could be triggered by COVID as well. And it's very less likely, much, much less likely to have anything to do with the vaccine. Along with the vaccine programs, I get asked a lot, and I know there's been a lot of questions out there about the interval between our first and second doses for the 3 vaccines that we have right now. And as you know, in BC and in Canada, our strategy is to vaccinate as many people as possible, as quickly as possible, for the greater benefit of everyone. And no more important is that than now, when we have started to see our cases take off again, and we know the effects that they can have. Even if people don't end up in hospital, we know that there's long-term effects that many people are experiencing from infection with COVID-19. So the strategy that we have taken protects us both as individuals and as a community. And this is achieved by offering the first dose of vaccine to more people, beginning with those at higher risk of having more severe illness. And we know that the single most important risk factor is age. And then we'll go back and provide a second dose. And we know Canada's National Advisory Committee on Immunization, or NACI, has looked very carefully at this evidence, as have we here in British Columbia, and advised that the time between the first and second doses of the COVID vaccines, all 3 of them that we have in Canada right now and in BC, can be extended up to 4 months. And this allows as many people as possible to get that excellent protection of 80% or more from as quickly as possible. The second dose will be offered as soon as all eligible people in British Columbia have received their first dose, or have at least been offered their first dose. And in most cases, that will mean less than 4 months. We are on track. If the vaccines continue to come, we're on track to get everybody offered a vaccine by early July, by the end of June. The other thing, though, that we will continue to follow is whether extending that interval actually has some benefits to people. And we've seen that with other vaccines, that the longer the interval you have, the more time your body's immune system has to develop that cell-mediated immunity. And that may give us better and longer-lasting protection. And that may help us get through the next respiratory season, even though COVID is likely to be with us for some time. So those are things we don't yet know. And we will be learning as we learn more about how the vaccines are working in people around the world. We also don't know how well these vaccines will continue to work as we see more variants of concern that are circulating in our province and around the world. This approach also allows people to benefit from their own protection as well as the protection that arises because others will be vaccinated. And that reduces the chance that any of us will spread the virus. And for some people, they don't develop as much antibody as we've heard about. Sometimes people with blood cancers, people who are older, may not have as good protection, even after 2 doses. So it is that much more important that the most of us in the community are immunized and protected, and that reduces all of our chances of being exposed to the virus in the first place. And that is something that we are seeing now with the dramatic decrease that we've seen in the UK, for example, when they've reached a tipping point in the population. One of the other questions I receive a lot is about how come we're immunizing healthcare workers and we're immunizing people who are extremely vulnerable, clinically vulnerable. We're immunizing elderly people because we know that they are at risk. And how come we're not immunizing the family caregivers as well, whether that's somebody who's caring for a child who can't be immunized or somebody who's caring for elderly parents. What we've learned is that these vaccines are very effective in protecting people directly, unlike many other vaccines. So we know it works well in elderly people, for example. So our priority is to get vaccine as it arrives into those people who are most at risk first, to protect you directly and then to protect all of us. We have immunized home care healthcare workers in long-term care and hospitals, etc., because they provide care to many vulnerable people. But when you're visiting an individual, your loved one or friend in a long-term care home, or providing care to one person in your home, you are only exposed to them. And that's why it's so important that we continue to protect ourselves directly by using the measures that we have in our community and to take precautions until our age group comes up. It would not be possible to immunize every family member or parent of every vulnerable person with the vaccines that we have available right now. So we need to do this on a risk-based process, and we know that the most important risk right now is age. The good news is that we will have more vaccines arriving, especially in the next few weeks, and we will all be able to receive our important first dose by June. Many people also wonder this week especially about the pause that we've had in the Covishield, which is the Serum Institute of India, the AstraZeneca vaccines for those under the age of 55, and how that may impact the immunization of workers in our worker program. So as we reported earlier this week, there has been a series of rare but very serious blood clots, sometimes in the brain, associated with low platelets that has been seen in a small number of younger people in Europe. Initially, the reports that we saw were about a risk of 1 in a million, but a study from Germany showed that there was about 29 cases in about 3 million doses. So that means it could be as high as 1 in 100,000. And really, it was the uncertainty. Health Canada, NACI, the Council of Chief Medical Officers of Health, which I participate in, looked at this issue in detail and decided we needed to have more information to determine what the risks and benefits were of this vaccine here in Canada. Very importantly, we have not seen any evidence of this here in Canada. There's been very low numbers around the world, several dozen only, but Because it is the risk of a severe illness and death being tied to age, as we've talked about, anyone over 55 especially, with the rates of transmission that we're seeing here in BC, the AstraZeneca Covishield vaccine clearly has benefits to you as an individual and to our community to make sure that we can get as many people immunized as quickly as possible. And these benefits far outweigh any risk of these very rare blood events. For younger people, we know they don't usually get as ill. So we want to make sure that these clots, because they can be severe or even fatal, we want to make sure that we know what the risk benefit is for younger people. And we're able to do that in BC and in Canada because we have alternative vaccines. But let me be very clear, we do not expect to see any of these cases in Canada. There's still scientists in Europe, in the UK, who are looking at this in detail and trying to understand what it is. This is a safety signal that we picked up because we are looking very carefully. When you immunize millions of people with new vaccines, this is something we watch for, and it's important that we're able to take action when we see something to get more information before we proceed. So if you have received this vaccine, be reassured that it works very well. It's an effective vaccine, and we know it's safe. And if it's beyond 20 days, then you're beyond the risk factor period for these very rare events anyway. But there is a test and there is treatment. So if you have any concerns, there's much more information on the BC CDC website about what exactly we're talking about, what are the signs to look for, and what the concerns would be. But I'm very confident that we will get to the bottom of this, and this is still an important vaccine for our programs here in Canada and around the world. The other questions that I get about these vaccines, we know that these vaccines, this AstraZeneca, work best when the second dose is at 3 to 4 months. And so people ask, if I've received it already, when am I going to get my second dose, and will it be with the AstraZeneca vaccine? And the answer is we're still working on that, and we have some time to figure that out, to make the best decision about dose 2. And this is something as well that we're collaborating around the world to best understand. The other thing that is happening right now in the UK, where this vaccine has been used in millions, tens of millions of people, is they are doing what we're calling a mix and match study. So they have Pfizer vaccine and the AstraZeneca vaccine that has been used widely across the UK, Scotland and other areas. And what they are doing is a study looking at taking the AstraZeneca first and then the Pfizer first and then the AZ, and what is the best dose interval. And we're going to have a lot more information about that and that study in the next couple of weeks, and that will help us give the best advice about what vaccine people should receive second, and it might be a messenger RNA vaccine, a Pfizer or Moderna vaccine, and when is the best interval for that. So we are responding, as I said, to a safety signal, and when we get more information, we will update our guidance. In the meantime, the vaccine is very effective and far, far better than getting sick with COVID-19. What this has meant, however, is that our worker program that was to start next week as we received more of the AstraZeneca vaccine will be put on pause for now. So the many workers and first responders who we were starting to get into that program, we're going to need to regroup, and we will come back early next week or as soon as we have more information to determine how we're going to move forward with that program. One of the other questions that I've been getting a lot of in the last week is, how did we determine who is clinically extremely vulnerable? And I understand there's a wide range of serious illnesses, and some people are wondering how that was determined. Well, I can tell you the list and the actual clinical conditions that people received letters, and I know many of you are receiving them now, was based on data from around the world and reviewed by a panel of experts led by physicians at the Provincial Health Services Authority. So that includes cancer specialists, kidney specialists, infectious disease doctors, pediatrics, developmental pediatrics, and important groups like Community Living BC, where we know many people receive services. So those groups are based on data and evidence and science. And we ask people, please, be patient. You should receive a letter by the 15th, and you will be able to book in after that for your vaccine. And I know many people have already. But we need physicians and people who are concerned that they're not on this list. We need your support to stick with these categories as they have been developed. Everyone will get vaccines in the next few months, and each group is protected as all of us are vaccinated. I've had many questions about the status of the J&J, the Janssen vaccine, and when we might be available. And the answer, unfortunately, is we don't yet know. We are hearing that there will be a shipment that we may receive by the end of April, but we have no timeline yet confirmed. So that's good news, and we will stay tuned and let people know. And the advantage of the Janssen vaccine is that it is a single-dose vaccine, so there's a lot of flexibility that can come with that vaccine. The other one that we know is on the horizon that may get approval in the next few weeks is the Novavax vaccine, also a very effective vaccine that we've not yet had here in Canada. And these will be very helpful. And what we are planning to do, again, because all three of these, the AstraZeneca, the Johnson & Johnson, the Novavax, are fridge-stable vaccines, being able to kickstart our first responder and worker program as soon as they become available. So if you have any other questions about our vaccine program, I encourage everybody to go to the BC CDC and Immunize BC website. There's much detailed information there for everybody about these vaccines, about who they work in, about the ingredients in the vaccines, and the things that you can expect. And the information there will be updated regularly. So as we come into this long weekend, all of us recognize our need to connect, and it has been a long, long year for many. But we need to ensure more than ever that we are socializing safely, because we do have an end in sight. All of this talk about vaccines and about how well they are going to work to protect us in our communities is in sight, but it's not here yet. If you do choose to spend time with anyone other than your immediate household in this weekend, it must be outdoors. And all of the COVID-19 safety plans and precautions need to continue to be followed. As more and more of our seniors and elders in particular are protected, we need to give that time for that best protection to take hold. That means ensuring you're giving enough space to others, staying away if you're feeling at all unwell, and staying with that same group, small group of people. I'd also like to speak to a little bit about expectations for travel. I know this is a time when people think about that. This is not the time for any of us to be traveling for leisure or vacation or getaways outside of our community. Travel is still very high risk for all of us. We've seen that. We see that we take the risk from where we are coming, and we take it home from where we have been. So if you are in doubt at all this weekend, just don't go. A good guideline is to think about staying within the area where you would go for a day trip. If it requires an overnight stay, a vacation rental, then it is not a good idea right now. If you need a break, go to a local campground. Stay in a local hotel. Staying local will support our local businesses. And we all know how important that is right now with the restrictions that we've had to put in place this week to try and get our numbers down. Get takeaway from your local restaurant. Support your local community. Today as well, our seniors and elders in care are safely able to be visited over the next few weeks. We know that families have been waiting for this for a long time, and it's going to be an emotional and a welcome homecoming. But we need to be cautious and be careful. We know that the immunization in our long-term care homes across the province has been very high, but we can still get virus introduced into homes, and we don't want that now. We know that everybody who's been isolated from friends and family for these many, many months need to have that connection, and we need to do it safely. So that means wearing masks, that means going by yourself, having your visit with your loved one only, and making sure that if you are feeling unwell at all, that you wait for another time. As we look to our long weekend, we need to make this a safe long weekend so that we can get through this phase of our pandemic as more and more vaccine is available in the weeks to come. We all have the same ability to spread COVID-19, and we all have the same ability to stop the spread, and we know what to do. Staying small, staying outside, staying local will help us bend our curve again as our immunization program moves up. I hope you all have a safe and enjoyable weekend, and please remember to be kind to each other, to be calm, and to stay safe.
Thank you very much, Dr. Henry. I wanted to start by extending my condolences. Those are the premiers, those are the governments, those are people in BC, to the family, the friends, the caregivers of the 5 people who passed away from COVID-19 or related to COVID-19 in the last 24 hours, 1 in the Fraser Health Authority, 3 in the Northern Health Authority, and 1 lived in Vancouver Coastal Health. It's a difficult time for loss. We know this. We know there's been and continue to be restrictions in the ways that we can grieve and come together. So that means we have to, in these times, I think, show more connection, more support for one another, more solidarity with one another. And I'm thinking of all of those families and all of the families who have lost loved one in this pandemic and in the other public health emergency, the overdose public health emergency. Dr. Henry's noted 296 people in hospital from COVID-19, 79 in critical care today. We continue, our healthcare workers throughout the hospital system continue to do extraordinary work under these circumstances. We continue to have lower capacity than we typically expect as we have made significant adjustments in our hospital system, but nonetheless, in areas of high COVID-19 transmission, areas such as Fraser Health, but also in Northern Health, we see real pressures in our hospital, and we want to, I think all of us want to support our healthcare workers in acute care as they work through all of the challenges that they're facing. I want to, like Dr. Henry, talk about a few issues that I get asked about, and the first, I think, is vaccine and immunization and supply. I just want to note that the fundamental issue, the real question, the real challenge that we all face is the amount of vaccine. Today, happy to announce that 787,549 vaccinations have been taken place in BC. That's 700,155 of those are first doses. That's 16.28%, or almost 1 in 6 of the population, and 87,394 are second doses. We announced at noon that those who are 72 and older, so a new age cohort, those born in 1949 or before, are now able to call in and book appointments. I'd note that that hasn't moved as quickly this week because we also added this week 150,000 people, or in the broader cohort, who will have received letters or will eventually receive letters, who are clinically extremely vulnerable. Dr. Henry has talked about how that list was developed, but that obviously is a significant addition to the list who are in our main COVID-19 program that is using Pfizer and Moderna. I want to say that it's supply, though. It's 1 in 6. And what has been exceptional in our immunization program led by Dr. Penny Vallon has been exceptional at delivering vaccine as it arrives in BC. And in fact, that is what has been happening consistently. And you can see that with the more than 90% of residents, more than 90% of staff in long-term care, in assisted living, both residents and staff, and healthcare workers. The fact is that First Nations Health Authority announced this week that every First Nations community around BC has now had their immunization clinic against COVID-19. These are extraordinary achievements. To take that much vaccine under that much scrutiny and focus on the groups that have the highest vulnerability is exceptional. In the 90 and above category, 44,913 people have been immunized out of approximately 50,000 people over 90 in BC. In the 85 to 89 category, it's 62,430 have been immunized out of approximately 72,000. In the 80 to 84 category, that's 88,555 people, and we're making progress every day on that. In the 75 to 79 category, it's 79,808. In short, all of the priorities that were laid out in detail in January have been for priority, for vulnerability, for saving lives with vaccine in BC have been the priorities, and we are in fact ahead of schedule. I told you from this podium that we expected approximately 10% of people to be immunized by March 31st. That number, because of the decisions that have been taken by Dr. Henry and others with respect to dosage, is 16.28%, which is better than 10%, but still, again, limited by the supply of vaccine. I want people to also understand that there has been and there is some inconsistency in when we get vaccines. So the week of March 22nd to 27th, for example, we expected, we're told that we'd receive 161,460 doses of Pfizer, and we received 161,460 doses of Pfizer. We were expecting 112,400 doses of Moderna that week. We received 34,000 doses of Moderna. We were expecting to receive the remaining 78,400 doses of Moderna from that shipment this week. And while we still expect it, and we expect all of that vaccine to arrive, that vaccine, 72,000 of it, is expected to arrive Saturday. If you look at next week, April 4th to 10th, we were expecting 138,060 doses of Pfizer and a further 111,900 doses of Moderna. But when that changes or when delivery is delayed, this is an extraordinary challenge. I think it's a real tribute to our teams that those changes have been dealt with seamlessly in a way that is obviously very challenging to deal with, but that I think our teams have done a very good job in doing. With respect to AstraZeneca, the changes as described by Dr. Henry and the safety signals changed our AstraZeneca campaign this week, as everybody knows. And so on Monday, that change and that with respect to people under 55 was announced. By Tuesday, we'd organized, working with the BC Pharmacy Association, work that had been ongoing on all these issues for some time, changed and put forward a strategy to ensure that the AstraZeneca that we had was used in full, and every dose will be used in full. And that meant that 18,000 doses have been distributed now to pharmacies across Metro Vancouver, and that is happening now. So that is good news. Learned on Monday, changed on Tuesday, people were immunized yesterday, which is impressive and a real tribute to the BC Pharmacy Association, our partners in this. We know that there are many more than 18,000 people involved in these categories. For example, just in Metro Vancouver alone, 198,561 people between the ages of 55 and 59, and 184,371 people between the ages of 60 and 64 just there, and many more, of course, around the province. But we wanted to make sure that all of our doses went out, and they have. The good news is that a further supply of AstraZeneca has virtually just arrived in BC. That's a further 188,800 doses, and more is expected next week. And over the next few days, Dr. Ballum and her team will be informing people of how that will be distributed. So, and we'll see a significant portion of that going in to our effort with the BC Pharmacy Association. I think all of that is good news. But that is the way I think our team has been working, focusing on those who need the most protection first and delivering vaccine very soon after it arrives in BC. I think it's a real achievement. I think British Columbians can be proud. When I hear from people who've been vaccinated, who go to our clinics across the province, they tell me story after story about how well they were treated, how efficiently it was run, and that is a credit to our healthcare teams. I am so proud of them and so proud of everyone involved in organizing this, and very proud of our partners in pharmacy as well. Dr. Henry talked briefly about long-term care. I'll be one of those people visiting a loved one in long-term care this weekend, but I want to say this. This is a time to be prudent and careful and generous. Our partners, whether they are in the publicly funded beds in a private care home or in a public care home. Our partners and healthcare workers need our support as well in making this work properly. We have to listen when we're advised about safety and follow safety guidelines. It is especially important now that we do so in every possible way. And so that means that if anyone is even thinking or close or feels they might be ill, not to visit a care home this weekend, even though it's been, I know, for many people, a year's wait. We have to be prudent and care about infection control right now. It is very important that residents of long-term care get visits. It's also very important that all of us stay safe. I want to just note very briefly today that health authorities report that in the week of March 15th to 21st, 6,894 surgeries were completed in British Columbia. And that is, of course, significantly more than last year. As you recall, last year at this time, the non-urgent scheduled surgeries or elective surgeries were postponed in British Columbia. So obviously that comparison doesn't work anymore. I just wanted to break that out by health authority. That's 1,993 in Fraser Health, 1,145 in Interior Health, 364 in Northern Health, 1,663 in Vancouver Coastal Health, 1,450 in Vancouver Island Health, and 279 in the Provincial Health Services Authority. I just want to say there is usually somewhat of a slowdown, which was less this year than in most years around March break, but I want to thank all of our teams, people, our anesthesiologists, our whole teams, our surgeons, our surgical nurses, our healthcare workers, our health sciences professionals, everyone involved in our surgery program, which continues to meet and exceed all expectations in this very, very difficult time to operate in BC. Finally, I just wanted to note that our online platform for the booking of immunizations will go live on April the 6th. I just want people to prepare for what the process will be. There'll be significant information presented publicly on all platforms on April 5th to let people know more about this. It's a process that will continue to be a call center. So for people who cannot use or aren't able, don't like to use online platforms, there will also be a call center backing it up, but our online platform will be in place on that day. The idea of it is when it's close to the time for your age cohort to come forward to register. When it's time for your age cohort to book, you will be sent a text or informed, and then you book your appointment. So it's registered, invitation, book. That's RIB, right? That's RIB. Okay. That's coming up April 6th, and I think it also will be a legacy to the province in terms of how we can track immunizations from a public health perspective, but also how people can get access to the information about their own immunizations. So that is rolling out next week, and there'll be more information coming forward. In closing, I want to say that today, we're going into the Easter weekend. It's typically, although not as much the last 2 years, my favorite holiday weekends of the year for all kinds of reasons, personal and otherwise. But this weekend, it's not about the person we saw going the wrong way down an aisle at a grocery store. It's not about the group we saw in the park that looked larger than 10. It's not about the person who seemed closer to us than 6 feet or the person whose mask wasn't on right. It's not about the mistakes any of us has made. Today is not about what we didn't do, failed to do, or should have done. Today isn't about our ideas about who led the spread. Today is about how we unite in the fight to stop the spread. Today is about what we can do, what we must do, and what we will do to stop the spread. Today is about where we are, about who we are, and about where we need to be. Today, 16.3% of the 4.3 million eligible British Columbians have had their first dose of our available vaccine. That's encouraging, but it's nowhere near enough. So today is the day in our hearts, our words, and our actions, especially our actions, when we commit to the simple truth. It's us and the vaccines against COVID-19. Our focus right now must be tight on what we need to do today and tomorrow and right through this Easter weekend to stop the spread. Let's focus on the immediate work at hand, and let's keep moving forward together, because we're all better when we're working together. We know how to dig in, we know how to dig deep, and we can get ourselves out of a tight COVID hold. So let's bend a new curve, not the old rules. It's us and the vaccines against COVID-19. Our aim is clear, our purpose is defined. Unite in the fight to stop the spread. Let's get on with that this weekend. Aujourd'hui, nous annonçons 832 nouveaux cas qui ont testé positifs pour COVID-19 pour un total de 880 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 5 nouveaux décès liés au COVID-19 pour un total de 1463 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 296 personnes sont actuellement hospitalisées, dont 79 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
As a reminder to reporters on the phone, please press *1 to enter the queue. You will be limited to one question and one follow-up. Please also remember to take your phone off mute. You will not be audible until your name is called. Our first question today is from Justine Hunter at the Globe and Mail. Please go ahead.
Thanks, and I almost hesitate to ask another question about vaccines, but the Pharmacy Association lobbied hard to get their members involved in this distribution, and I'm wondering, Mr. Dix, did the province negotiate any kind of commitment that they would not offer preferential treatment to their own customers for this very in-demand vaccine?
So let me just start by saying they've been lobbying, yes, but we've also had a very strong partnership with pharmacists since 2009, during the influenza pandemic in 2009, when pharmacists in BC became important partners in immunization. So this is in negotiation, discussions that we've been having ongoing since we started to have vaccines available. So they have always been part of our program.
I don't think this is an issue of anybody lobbying. In the midst of this pandemic, more than 1.1 million doses of influenza vaccine were delivered by BC pharmacists. In the context of a pandemic, it was an extraordinary success, and roughly 450,000 more, I believe, than had been done last year. So we're working pretty closely with BC pharmacists. The Pharmacy Association has been partnered with us and working with us as we prepare for the many phases of this immunization campaign. I think I've said already, I think Dr. Henry said already, that especially for second doses, we see pharmacists playing an even more central role than they play now. And I think it's impressive that as we made changes required by safety signals with the safety and health of people in our province, we made changes to our program this week. Pharmacists stepped up, and the BC Pharmacy Association stepped up and did this work. And what we have is a process of between 55 and 64 that people were able to book appointments. We know, Justine, that there are hundreds of thousands of people in this category, and initially we were distributing 18,000 doses of AstraZeneca. Why did we do that? Because we wanted to make sure that every drop of vaccine goes to people in BC before any expiry date. That's why we proceeded in the way we did. But that is the basis now as we expand out the number of pharmacies, and I think next week the number of communities involved. We are going to be able to have more and more success at delivering that. It's not what was planned. As Dr. Henry has said, we've made some changes this week because circumstances changed, because what we could do changed. We adapted, and the BC Pharmacy Association and pharmacists were part of that, and I think it's been very effective so far. So really, the idea is to deliver between people 55 and 64 as we continue to go down and down and down in ages in our main age-based campaign, and this will assist that and obviously assist the speed of that campaign when the age-based campaign meets that 55 to 64 cohort in not too long a while. So pharmacists are doing a good job. They're delivering. They're going to be delivering, I think, in these days about 18,000 doses of AstraZeneca, and really you qualify in that vaccine program from being 55 to 64, and everyone who gets immunized will have to be in that age cohort.
Justine, do you have a follow-up?
I I do. The question, though, is about an issue of preferential treatment. And we've spoken to two individuals who say they were denied a vaccine because they were not regular customers of the pharmacy they were trying to get the shot at. So my question is that acceptable, or do you think that it needs to be explicit that pharmacies are not going to favor their own customers with this vaccine?
If you talk to the pharmacies, the issue here is supply. The issue is that we have hundreds of thousands of people eligible in these categories, and right now we had 18,000. As I told you, we were about to receive a very significant, we have received and will be distributing out over the coming number of days, over the weekend. Probably it'll be starting next week, further 188,500 doses, much of which will go into this program. So that's the issue. The issue is supply, as it always is. We would like to be immunizing way more people in BC, but we're immunizing to the supply that we have. And again, this isn't a criticism of the Government of Canada. We don't have domestic capacity. Really, the countries that are well ahead of us in the percentage of immunization have the domestic capacity to produce vaccine. We don't have that in BC. And so we're limited by supply. And so it's inevitable when you have this much demand for vaccine, more demand for vaccine in an age cohort than you have vaccine available. There are some people who aren't going to be on that. But we're working closely with the Pharmacy Association and with pharmacists across BC. I think they're going to do a great job. I am so proud of the work pharmacists did in the influenza campaign. And the key point for everyone is everyone is going to get access to their first dose by the end of June. That's what we are seeing now, given the supplies we expect to be coming. Everyone is. But whether you're vaccinated or not vaccinated, it's critical right now to follow public health rules. I'll give you one example as to why. In Prince Rupert, we've immunized about 9,000, a little over 9,000, I think it's 9,008 people in the town of Prince Rupert in our campaign, in our effort there in the last week, our all-of-community effort in Prince Rupert. In the last number of days, the last 4 days leading into today, I believe 67 people tested positive for COVID-19, partly because they would have had the transmission prior to their immunization, but also because, as Dr. Henry has explained now in some detail and did today, it takes some time for the vaccine to take full effect. So what that means is that everyone's going to get their chance before the end of June, and our determination, my direction, is to get vaccines into the hands of the most vulnerable first, and to get it out as quickly as possible. And that's what we've been doing in BC. We're only limited by the amount of vaccine we have, and we're delighted every time any vaccine arrives in BC, as it did today.
Our next question is from Richard Zussman, Global News. Please go ahead.
Dr. Henry, we haven't seen the variant numbers in a few days. I'm going to assume the variants continue to climb. Why are we not doing anything specifically to address variant spread? I'm sure you've heard from other experts who say that we should be adjusting parts of our plan to note variant spread. I'm just curious why we're not, and is there anything specifically that can be done around the Easter long weekend when people may be more likely to gather indoors for supper or for a holiday gathering?
Yeah, so we did report on the variants, and it'll be in our statement today. But I can tell you over the last 2 days, because it's the whole genome sequencing is only run periodically during the week, and they missed a day. So we had 90 new cases identified as variants in the last 2 days. The 80 of them were B117, one more of the B1351, which is associated with South Africa, and 9 more of the P1, which is Brazil, which we've been watching very closely. Most of the P1 is one of the ones we're most concerned about, is in the Vancouver Coastal Health region. And we have, of course, adjusted our approach to ensure that we're doing surveillance. So now we have over 90% of all of our positive cases are screened for variants of concern, and there's a delay. It takes a day to do the screening test. We screen for a specific marker, and then we do the whole genome sequencing to see which specific variant it is. So what we know about these variants of concern, we've talked about, they spread more easily in most cases, and in some cases they lead to more severe illness. We're also concerned that some of them seem to have a reduced response to some of the vaccines, although new data that's come out this week has shown that particularly the B117, all of the vaccines that we have in Canada work well, and same with the P1. It's the B1351 that is a little bit more concerning, but it still has good response. So what we also know is they may be more transmissible, but the very same things that we do to prevent the old viruses that we were seeing are the things that work for this as well. But what we know is that margin of error is that much less, that it can spread more easily. So we're seeing more contacts who become positive as well with some of these variant cases. And yes, we're doing additional testing. You saw that in some of the exposure events we had in schools, particularly in Surrey, around the B117. And thankfully what we found was that there was not transmission in the schools for the most part. So that's good news. We are doing additional testing, but every single case in BC is followed up, whether it's a variant or not, and we often don't know until a couple of days later. So we are watching carefully around hospitalization rates and people who end up in ICU. I can tell you that especially we've been investigating, there was a large cluster in Vancouver Coastal. That is now contained, and there's been an increase in these P1 in Vancouver Coastal and Whistler, and some of that has spread to other parts of the province in very small numbers, but we are watching very carefully and following up people very carefully. But there's no focal super spreading event that's related to these. What we're finding is there's small chains of transmission in multiple areas that aren't linked. So it is community spread, and that's why it's so important that we take the actions that we did in and around Whistler to try and reduce those opportunities for spread. And we are supporting people to self-isolate if they're in group accommodations, for example, to isolate safely. We have places to support people to do that. So the same measures that we take that for COVID all along work for the variants. We just have to do them more carefully, and that's more important than ever this weekend.
Maybe the active case numbers as well.
Oh, yeah, the active case numbers are actually down a little bit. This will all be in the statement, but they're down to 192, and we have 35 people who are currently in hospital with one of the variants. I've mentioned this before, but we do follow the demographics, and what we're seeing is it is mostly a younger age group between 19 and 50 overall, and for the P1 that we're seeing, not surprisingly given where we're seeing it, mostly 19 to 39-year age group.
Richard, do you have a follow-up?
I do. I've heard a lot from a group of people across the province from age 65 to 71 who quickly saw people slightly older for them get chances to reserve vaccinations. They have now seen some younger than them in Metro Vancouver not be able to receive AstraZeneca. There's a lot of frustration from this group that wants access to the vaccine. I know there was an update today for one of those years, but can you give these people some hope of when they will be able to register for their vaccine and explain to them why seemingly it is taking much longer to get to them as it was some ages around them?
Yeah, you know, and there's two different things that are going on there. One, as we've moved down the age groups, it has been very closely tied to amount of vaccine that we've received. And Minister Dix mentioned we were expecting a large shipment of Moderna last week, which was delayed, and still a large part of it hasn't arrived. And in addition, we have the clinically extremely vulnerable group that has now started to be in, and that's another 150,000 people. And as we move down every single year, the number of people or the cohort gets larger. So it was, and some of the health authorities, particularly in the Lower Mainland, when they had vaccine last weekend, had gone down to 73. But then as more vaccine didn't come in at exactly the right time, it was kind of stuck at that age for a couple of days. So we are titrating it to vaccine that we receive, and we've gone down today. We expect in the next few days, as more vaccine comes in next week, assuming it all arrives when expected, that we'll be able to continue to move down to the, hopefully very soon, to 70, 65 and up. So the rationale or why we had a small amount of the AstraZeneca, it was after we had seen the safety signal. We weren't sure how many people would be receptive to receiving it, and I'm just very, very pleased that people have recognized the value of this vaccine, and we had a small amount of it that was expiring tomorrow, and we targeted it in the area where we have the highest risk.
Roommates at odds.
I made a point of civility.
Bev's perception is inaccurate.
I have never raised my voice.
She didn't let up.
And the hostility
To slight those in the 65 to 72 age group, it was because we knew there was more vaccine coming into that core of our program that would be available within the coming days and weeks. So it's trying to find that balance of getting both at the same time as much as we could. And really what the challenge has been that I'm working on, that we're working on, is we were committed to using the more flexible fridge-stable vaccines for our worker program, and we'll need to recalibrate how we're going to do that. So I'm asking for patience from all of our first responders and the other worker groups that we had identified. We have been using vaccine, as you know, to try and address workplace outbreaks, and we don't have that supply right now because of the stop on using of AstraZeneca with the younger age group for now. So we are hopeful, and we'll be following. I know much of my weekend will be looking at the data that's coming out of Europe and following up with our colleagues in Health Canada, and hopefully we can get that back on track as soon as possible.
Our next question is from Marcella Bernardo, News 1130. Marcella, please go ahead.
Hi, Dr. Henry and Minister Dix. I hope to ask you more about the situation involving Alberta now looking at making people who've tested positive for variants of concern quarantine for up to 24 days. What efforts are being made here in BC to ensure those who are supposed to be quarantining for at least 14 days are actually isolating themselves and others in their homes?
So that is, there's a bit of a nuance to that, Marcella. So it is if you are in a close contact with somebody who is positive with one of the variants, because it's more transmissible, and we're seeing transmission in households. So if you are still in that household and people can't effectively isolate within that household, then you are no longer infectious after 10 days. And the quarantine period for your close contacts starts after that infectious period. So that's where you get the 24 days. So they are supporting some people to leave their household for the 10 days of their infectious period and be in hotels or other places. And we have done that in some places as well. Whistler's a classic example where we had a lot of transmission in accommodation, in group accommodations that were related to workplaces. We were able to go in and do some immunization there as well, but it's very challenging to find places for people to safely isolate. And for some families, that's not acceptable to them, so they would prefer to be together at home for that whole period of time. So it's a combination. We've been doing that in many areas of the province. The clusters in the community in Big White and some parts of the downtown east side where we're able to effectively separate people. Right now, we do case management and contact tracing and do work with families and have also do asymptomatic testing of people, particularly focused on people with these more transmissible variants. So it is a strategy that is, it's more of a localized decision with the local contact tracing team on an individual basis.
Marcella, do you have a follow-up?
I do. I forgot to ask you how many people are isolating now, but if you could add that in. And the other question I had was that you mentioned during your earlier comments about people now having to wait. Could you specify, is that first responders, teachers, like are they essential service workers that may now have to wait a little bit longer to get a specific clinic done for them?
Yeah, so all of I didn't go through all the details today. I'm trying to, do these questions things on Thursdays so that we have a little bit more time to get into some depth. But it will be in the statement. We have about currently active. There's a comma in the wrong spot. I almost had a fit here. It said 75,000. I think it's 7,571. So that is up considerably right now. But in terms of the active cases that are variants, it's down to 192. And there's now about 11,600 people who are self-isolating right now. And yes, our intent was always, the main part of our program was the age-based program with Pfizer and Moderna. And we have this parallel stream that we started with first responders, with workplaces, that was dependent on our fridge-stable vaccine that we were doing in communities with pharmacies and pharmacists assisting at workplaces and work sites. So that is on pause now because most of the workers are younger than 55. So we are recalibrating. We're going to be following, as I mentioned, what's happening with around the world with the data around this vaccine. And I am confident that we will be able to get back to that program soon. But we need to make sure that we are all comfortable with the safety and with who the best population to use it. So that's why it's so important that it looks like we might be getting some Johnson & Johnson vaccine. That will allow us to take that program going again, or Novavax if it comes in the next few weeks as well. So it is a pause on that program for now until we get more information about how we can best do that and move it forward again.
Our next question is from Binder Sajan, CTV. Please go ahead.
Hi there. Minister Dix, I want to ask you, because I know you defended the Premier's comments earlier this week when he made them to people in their 20s and 30s. There appears to be another group of people who continue to travel despite the recommendation not to. CTV found some at the ferry terminal today who knew the rules, who heard the message, and traveled anyway. I'm just wondering why you think maybe the message isn't getting through, and what would you say to them?
I'm going to say something first, too, which I've said all along, that we know that the people who have had the biggest challenges to overcome over this past year and over a year now, and who've had, in many ways, the least influence on events have been young people, and whether it's people who are graduating from high school, and I know there are youth in my life who've been through this, and not having those important celebrations of passage, whether it's young people whose job prospects have been damaged because this virus transmits and has affected the food and beverage sector and the hospitality and the tourism sector. So I have a lot of empathy for young people, and I know it's a very challenging year, and we as a community and society have an obligation to make it up to young people.
I think I'd say to them what we said consistently throughout, which is that it's not too late to join the fight, that this is going to be a very difficult month. We really need people to follow public health guidance and public health orders. With respect to young people, this is the reality. The reality is there is increasing transmission amongst young people. That's variants of concern, in particular. The median age of people with the P1 variant, the variant associated with Brazil or discovered in Brazil. The median age is 28, which means that half of the people, essentially, who get the Brazilian variant are under 28. And I think we have to put that in context. Those numbers, that risk, the risk to parents and grandparents and loved ones, and the risk to ourselves here. If we look around the world in jurisdictions where the variants have grown and where we're in the same circumstances as we are, which is most of the other provinces in Canada of our size, and many countries, for example, in Europe, you're seeing increasing number of cases right now linked to the variants. Increasing number in those jurisdictions of young people in hospital, increasing numbers of young people in critical care, increasing number of young people passing away. So for yourselves, for the ones you love, for the ones you don't know, it's critical for that group and everybody else to follow public health guidance right now, especially now. This is about all of us. We're in the midst of a vaccination campaign which has been rolled out, I think, extremely well in BC. But it's, again, 1 in 6 of us vaccinated, and even they have to continue to follow public health guidance. But for the rest of us, it's time, I think, for us to really dig in, because it would be a terrible thing for all of us, no matter what your age, 25, 35, 45, 65, 85, to at this final moment in the COVID-19 pandemic, of this phase, any of it, of this immunization phase of the COVID-19 pandemic, to get sick. And we've got to do everything we can to avoid that. No one's to blame for getting sick. Presidents have got sick. Prime ministers have got sick. All kinds of different people have got sick. Although those who are most vulnerable, for either by social determinant of health or most vulnerable for other reasons, for health reasons, are most at risk. But all of people with deep information and lots of support and medical advice and all the best doctors have got sick. We don't blame people for getting sick, but we do have to come together now, us and the vaccines against COVID-19. That's what I would say to people. It's time for us to come together and listen to public health guidance and follow those orders, especially for this period that we're in now, this period between now, really in the end of June, as we're providing everyone their first dose of vaccine.
Binder, do you have a follow-up?
I wanted to ask about the variants. That there's a relatively low number, I guess, a lower number in the last couple of days, and just wondering, what is the takeaway? Is that good news? Is it a blip? And also, with the positivity rate in BC growing and being quite high in some parts, is it time to expand testing?
I'm not sure where we would expand testing, and we do have quite a lot of testing being done. We have asymptomatic testing being done where it's appropriate. Part of the reason that we're seeing higher % positives in places like the North, for example, is because we are testing the people who are most at risk, and so that's appropriate. The fact that we've seen a lower number of variants in the last couple of days, even though our surveillance has ramped up, it's too soon to tell. We've certainly seen small numbers in different parts of the province, and we're focusing on those, trying not to let them take off. But I think there is an inevitability. There's a replacement, at least, of variants, particularly the B117, and it is replacing the virus that we used to see because it has an ecological, or I'm trying to think of the name of it, what I'm trying to say, but it's on the end of my tip of my brain, but because it's got a survival edge. So we see this all the time, where it's able to, survival of the fittest, it's able to take over. So we are, of course, paying attention to it and monitoring very carefully, but we'll see. Most important is to reduce transmission, and we reduce transmission, we reduce all of the virus that's circulating in our community.
We have time for one more question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. Our last question today is from Tanya Fletcher at CBC.
I was just going to say it's competitive advantage. That's what I was trying to think of. So the 17 has a competitive advantage and has been moving out the other viruses that we've been seeing. So sorry about that. Go ahead.
Oh, hello. I just wanted to ask about variants as well. And I know that you've said in the past that more young people are being hospitalized. We know that. And you also mentioned today that more young people are having cases with the variants. But Alberta's provincial health officer just said they're seeing more young people hospitalized due to variants. So is there updated data around the correlation between variants and young people needing critical care in BC? Are there any new commonalities emerging here about which demographics they're hitting and why, and which settings they're spreading in? I mean, you mentioned community spread, but do you have specifics?
Yeah, so I did present that data on Monday. About so what we're not seeing an increase proportion of younger people who are hospitalized. So it's about the same as what we're seeing for all of the other, any virus, about 5%. If anything, it's a little less of people who have a variant case who are hospitalized. But because we are seeing an increase cases in younger people, the numbers of younger people in hospital have gone up. And that means that the numbers, younger people are thankfully more likely to survive. So we know the length of stay is longer, and they more often are needing ICU care. So the percentage of younger people who are in ICU has gone up. It was about 19% of all ages, so still 5% of people are hospitalized, 19% of all ages need ICU care. People with variants, that's up to about a third. So we are seeing, but the numbers are still relatively small. We're in I think that we're up to about 60 people now. So it does make a difference. We're looking at that in some detail, but where we're seeing transmission, again, is the same settings that we're seeing it, and why we took some of the measures that we did this week. What we see is transmission in social networks, so where people are having social gatherings together, and many of the same people are working in the restaurant or hospitality industry, living in group accommodations, living in crowded homes with others. And we're seeing spread in all of those environments. And particularly, we know that these variants and the virus that we're seeing is spreading more quickly indoors. So our margin of error for having people together, not wearing masks, indoors, with poor ventilation, talking, laughing. You've seen some of that on some of the video from certain places this week. Those are situations that are very risky right now. So that's why we have been focusing on where we can do things safely, and that is outside. Keeping our distance outside, having those social interactions in ways that are safe right now, particularly if you're going to be around your elders and seniors, and make sure that we can do that safely so that we can all get through this and be protected.
Tanya, do you have a follow-up?
Yes, and if we could get an answer in French from Minister Dix as well, that would be appreciated. Thank you. We've seen some staggering case numbers in the days since the circuit breaker was announced on Monday. Can you tell us what British Columbians should be expecting in the coming weeks, as in how will we know if the circuit breaker is working and when? Give us the measuring sticks we should hope for.
So one thing that is still the same is that the incubation period is about 14 days, and the most transmission that we see after exposure is about day 5 to day 7. So we are now in the place where there's a large number of people who have been exposed. We talked about it's about over 11,000 people right now who are close contacts, and this is what I'm hearing from my colleagues who are doing contact tracing and case management, that the numbers of contacts that individuals are having in risky contacts, so contacts where it can be transmitted, has been going up. And that is one of the reasons why we took the actions that we did. We were, as you know, sort of keeping our own with the actual infectious contacts staying fairly low. And that has increased in the past 10 days. And that's what we've seen, the spike. So we are not out of the woods by any means. There are 11,000 people who have been exposed. A proportion of those people each day for the next 2 weeks are going to develop illness. But the things we do today will prevent that next generation of cases. So we are likely to be in for a rough ride for the next few days. And those people who have had contact with somebody who's been ill, you need to stay away from others. You need to stay safe.
And just to say, Tanya, I think the presentation was last Thursday on the variants information. So it's on the BC CDC website and associated with the presentation on the day. But we can also provide it for people again. Je dirais en français que on a pris cette action lundi. La transmission, nos rapports nos présentations d'aujourd'hui sont fondées sur les transmissions de la semaine prochaine et la semaine avant, bien entendu. Donc, ça va prendre des jours pour que ces mesures aient un effet sur les présentations qu'on fait, le nombre de tests positifs de COVID-19 qu'on voit dans ces présentations comme celle d'aujourd'hui. Donc, ça va prendre quelques semaines. C'est la raison pour laquelle le Dr Henry a choisi 3 semaines jusqu'au 19 avril pour cette période de changement, de mesures pour réduire la transmission de COVID-19. Donc, c'est pas aujourd'hui. Aujourd'hui, c'est une réflexion de la semaine dernière et avant, mais ça va être à la fin de la semaine prochaine ou la semaine après qu'on va, j'espère, voir les effets de ce qu'on fait aujourd'hui et ce qu'on fait cette semaine. Ce qui est essentiel, c'est que tout le monde suive les conseils de la santé publique actuellement. C'est une période difficile, une période d'espoir à cause des vaccins, mais aussi une période difficile à cause de la transmission accélérée de COVID-19 actuellement. Donc, il faut que tout le monde maintenant suive les règles et les conseils de la santé publique. C'est essentiel. Happy Easter. I wish everyone a very, very good long weekend, and you'll be receiving a report, members of the media and of the public, about cases on Saturday. Thank you.
That's all the time we have for today. Thank you, everyone, for joining.